What quality checks are done for CF newborn screening? Imagine catching cystic fibrosis early enough to make a real difference. That's what newborn screening aims to do, and it relies on a series of careful quality checks to make sure the results are accurate and reliable. First, the process begins with measuring immunoreactive trypsinogen, or IRT, in a tiny blood sample collected from the baby's heel. Labs validate and calibrate their IRT tests regularly to ensure the measurements stay consistent. They often use a floating cutoff point rather than a fixed one, which helps catch more true positives and reduces missed cases. To keep standards high, labs participate in proficiency testing and quality control programs, which provide known samples to verify that their testing methods are working correctly. When IRT levels are high, the next step is genetic testing for mutations in the CFTR gene, which causes cystic fibrosis. Quality assurance here involves using comprehensive mutation panels that include all common and rare CF-causing variants recommended by experts. Some programs even perform CFTR gene sequencing to improve accuracy. Labs use well-characterized control samples with known mutations to regularly check that their genetic tests are performing properly. External quality assurance programs, like those run by the Centers for Disease Control and Prevention, are also part of the process. These programs send proficiency testing samples to labs to monitor their performance over time. This ensures that different screening sites maintain high standards and produce comparable results. Another important aspect is specimen quality. Proper blood collection and handling are crucial. If a sample is inadequate or results are unclear, labs request a repeat specimen promptly. Guidelines specify the best timing for collection, usually within the first few days after birth, to avoid errors or delays. Once screening results are available, timely notification is essential. Healthcare providers and cystic fibrosis specialists are informed quickly about abnormal results, so they can confirm the diagnosis with additional tests like sweat chloride testing and clinical evaluation. This step helps start treatment early and reduces the chance of complications. Finally, newborn screening programs continually review and improve their procedures. They analyze data on false positives and negatives, adjust IRT cutoffs, update mutation panels, and refine follow-up protocols. This ongoing evaluation helps ensure that every infant gets an accurate and early diagnosis, regardless of their background. In summary, quality checks for cystic fibrosis newborn screening involve validated biochemical tests, comprehensive genetic panels with quality controls, participation in external proficiency programs, careful specimen collection, prompt result reporting, and continuous program review. All these steps work together to make sure that babies with cystic fibrosis are identified early and accurately, giving them the best start in life. Always remember, if you have concerns or questions about screening results, it's best to consult healthcare professionals who can provide personalized advice based on the latest medical standards.